We and our members have been waiting with eager anticipation for sight of the Model Region Blueprint, the document that will set out how the English regions will be managed in the future and what that means for ICBs and providers alike. It's an important document because without sight of it, members are unable to move forward with their planning. With me to discuss the implications of not yet having the Model Regional Blueprint is Sarah Walter, Director of our ICS Network. Welcome to Health on the Line, Sarah.
Thanks for having me, Matthew.
So, uh, some people will know all about this issue, Sarah, others will have no idea at all. So, can you bring us up to speed on this question of the model region blueprint? What is it, and why is it important to our members?
Yeah, well, I'm sure all of our listeners will be aware that there's significant change going on within the health service at the moment. We've seen announcements earlier on this year about changes to the centre, NHS England um, becoming absorbed into the Department of Health, and a cost reduction, a headcount reduction of around 50%. ICBs, so integrated care boards, also told in the spring this year that they would be expected to achieve a cost reduction of 50%, and changes also to providers. And so lots of change within the overall NHS operating model, of which the region is an important component. Um, and we've seen a lot of activity, I think, underway, in particular in relation to integrated care boards. ICBs have been part of developing the model ICB blueprint, which was published at the beginning of May, process led by Penny Dash at NHS England. And in parallel, work has been underway on the model region, which is a really important component of this operating model. ICBs already work really closely with the region, as do NHS trusts and providers across regions. And so understanding how the regional component of the new operating model is going to work is a really important dependency for all the other parts of the system. The original expectation was that that model region blueprint work would be complete by the end of July, and we understand that work was largely complete by then. But we have yet to see a final kind of published document that ICBs and providers can use to support their own planning and think about their functions and their way of operating in the future. So it's an area that I know many members will be keen to see and engage with as soon as NHS England are in a position to release that.
And do you have any sense, Sarah, of what is the cause of the hold-up?
I think, clearly there's been a need for engagement. The regional component has an interdependency and a kind of interplay with ICBs, with providers, and also with the centre. And so I think, there's clearly a desire from NHS England and the department for that regional layer to benefit from those kind of connections, and really kind of make sure that it works in the context of how the new centre is going to operate as well. And we know that those conversations are live right now. Richard Barker is leading that process of change for the centre, and the regional component is an important part there. So we understand there's discussions happening between NHS England and the department in particular over the summer. And we're hopeful that we'll be able to see something soon. But certainly our members are pushing for NHS England to be releasing that blueprint as soon as is possible.
Yeah, and Richard Barker is clearly, couldn't choose for a better person to be overseeing this process. And from what I'm hearing, Sarah, it echoes what you're saying, which is that this is partly got wrapped up in this question of the NHSE moving into the department. These are NHSE regions that will soon be departmental regions, and those are rather different kinds of things. It also kind of picks up differences. I hear, when you talk to people in the department, they talk about NHSE being subsumed, abolished, being subsumed in the department, whereas in NHSE, they tend to talk about merger, and they tend to point out that there isn't yet an absolute date at which this is going to take place. So there are differences, but what impact does it have on our members, in particular ICBs, the fact that we don't yet have this regional blueprint?
Well, I think ICBs, there'll be a certain degree of frustration, I think, given the pace at which ICBs have been required to pull together their plans. So, the model ICB blueprint was published at the beginning of May, and ICB's had until the end of May to submit their first cut of cost reduction plan. So how are they going to change their organisations in order to deliver that model ICB blueprint? We know ICBs have been in discussion about clusters and mergers, and that is all progressing at pace. But there's a really significant interdependency between how ICBs operate in the future and how regions operate. The model ICB blueprint lists a number of functions which are anticipated to move to the region. And I think it's quite difficult for ICBs to kind of plan their future design and how they're going to operate without also understanding how regions are expected to operate and being able to kind of develop that ICB plan and how it's going to kind of dock into the new regions and their way of working. So there is a kind of, I think it does add an extra layer of complexity into what is already an incredibly complex situation for ICBs to manage.
Yeah, and this affects, of course, the capacity of anybody to deal with what are, challenging issues, but also areas where there is potential, given the financial constraints we're under, to think about how we could do things better. So, for example, continuing healthcare, well, we know there are huge variations one part of the country to another, difference in the kind of criteria for accessing that, which has a big impact on patients, kind of postcode lottery, safeguarding, where I think there's a sense at the centre that potentially more money has been spent on safeguarding that needs to be could be potentially rationalised. We need to be clear about what it's about. But I just want to focus just a little bit, so on one other issue, which is around kind of emergency planning. That's a function, as I understand it. You'll correct me if I'm wrong. That's kind of slated to move from ICBs to regions. Now, winter, I go swimming in the mornings. So for the first time this morning, so cycling across York, my hands felt cold. So winter is starting to come, and that's when that kind of capacity emergency intervention is particularly important. We do need to sort this out ahead of winter, don't we?
We do, although there has been some clarification. So some FAQs were published back in June. So this is after the model ICB blueprint was published, saying exactly that. So some of these functions that ICBs have historically managed, in particular things like EPRR and things like system control centers and managing winter. So the FAQs published in June clarified that ICBs will continue to hold that responsibility for this winter. Each ICB has been told to nominate a winter director. They'll remain accountable for that EPRR function for this year. But how this works longer term is clearly an important question. And even in the short term, there's clearly significant change underway in ICBs with their cost reductions and the potential redundancies that may flow from that. Although, I think as we've described in previous episodes with Health on the Line, and certainly have been talking about within the Confed, those restructures themselves are also at risk given some of the questions still about redundancy and how those financial costs will be borne. But I think that I guess one of the principles around all of this is trying to have clarity in the midst of complexity, and that clarity continues to not be forthcoming while we're waiting for big parts of this jigsaw to be confirmed.
Yes, well, I think we can say in summary, can't we, that ICBs continue to find themselves in a situation of doing their best, preparing for winter, but not really being supported in undertaking the changes they've been required to undertake, and that colleagues at NHS England and the department are coming back from their summer holidays with a pretty big and urgent in tray. Sarah, thank you so
Absolutely.
much for joining me.
Thanks for having me. All right. Thanks very much.